Purnima Balaju from FASS. Quite frankly, I don't really know much about it. Not really.
ADHD stands for Attention Deficit Hyperactivity Disorder. ADHD is a learning disorder, and it is often identified in childhood. There are 3 subtypes of ADHD, each with characteristic behaviors: inattentive, hyperactive impulsive, and combined. Some signs of ADHD are long-term hyperactivity and the constant inability to concentrate and attend to details.
Well, I have a younger cousin who has ADHD.
ADHD is the most commonly diagnosed psychological disorder in children. A larger number of boys are diagnosed with it than girls. The number of new ADHD cases increases by about 3% every year. Therefore, it's important that people who are suffering from this disorder receive adequate treatment. Some drugs which are commonly used in treatment are stimulants such as methylphenidate and amphetamine. Psychotherapy may also be used to supplement the medication. The medications used have been proven to reduce the symptoms of ADHD, and they allow the affected individual to function in normal situations. In addition to this, they have been approved by major regulatory agencies such as the Food and Drug Administration, or the FDA, in the United States. However, there has been some disagreement about the use of stimulant medications in the treatment of ADHD.
It really depends on the situation. For my cousin, when she takes her medication, she seems to be able to focus on time, but the problem is that the side effects that comes with it, that's the more worrying thing. Although some people say medication should be given on a short-term basis to help cure the disease, people like my auntie, she has concerns about its side effects. So if you ask me personally, I think it shouldn't be medicated, especially to young children. Basically, after she takes the medication, she becomes very lethargic, a bit unfocused, or she just falls asleep.
The safety of stimulant use in treating ADHD has actually been questioned by a number of researchers. Studies show that drugs which act on the central nervous system can have adverse effects in children. In addition to this, the prevalence of medication abuse is increasing, particularly with students who use it as a study aid. Experts are of the opinion that if a disorder such as this is diagnosed, it should be treated so the patient can enjoy a higher quality of life and be more successful. However, since the main method of treatment for ADHD is medication, it is controversial for a number of reasons. Firstly, it's usually young children who are diagnosed with ADHD, and secondly, the medication that is prescribed is amphetamine-based. This presents the possibility of drug abuse. In my Science undergraduate journal article, I will explain why medication prescribed for ADHD must be regulated more strictly.